So good day, ma'am. So for this video, I am going to administer an oral medication. So the first thing to do is assessment. We need to assess the patient, check the MAR against the healthcare practitioners, written orders, to ensure accuracy in the administration of the medication. We need to review each drug to given its action, indication, dosage, side and adverse effects, expiration dates, and nursing consideration. We need to assess ability to swallow foods and fluids. For example, gag reflex, because it allows the care provider to hold medication if not tolerated, and decrease the risk of the aspiration. Assess the client's acknowledge about the use, because it provides date to determine if the medication should be given. Assess client's condition and check for drug allergies, decreases risk of allergic reactions such as hives, or anaphylactic shock. Next, we should have a planning before administer an oral medication to the patient. We need to wash our hands for infection control. So I already washed my hands and obtain necessary equipment, all the equipment that we needed, because it promotes efficiency and organization in doing the procedure. Clarify and complete or unclear order with a prescriber to ensure that the right client receives the right medication. We need to calculate the medication dose, and if necessary, double check the calculation for the accuracy. So determine if the medication will be given orally, sublingually, or buccally. So in this video, I am going to administer medication orally, sublingually, and buccally. Next is the required medications that are cloudy or altered color, because we need by this to ensure administering non-contaminated or unexpired drugs. Place tablets, capsules requiring pre-administration assessment in a separate cup if we needed, because it allows healthcare provider to observe nursing consideration and giving medication. We will move on to implementation. Before administering the drug to the client, we need first to identify the client and explain the procedure. So, sir, I am Hazel P. Qualing, and I am your student nurse for today. So, may I know your name, please?
Yes, my name is Devo F. Briton. I am 90 years old.
So, Sir Devo, today I am going to administer a drug orally, buccally, and sublingually. Alright, sir?
Yes, ma'am.
So, it is important to explain the procedure to the client so that we will have a cooperation. He will cooperate us, and to prevent anxiety to the client. And it is important to identify the client so that to ensure that we give the medication to the right client. Next is check MAR to make sure all medication to be administered have been prepared. And place next is after that we move on to administering medications. took medication to client with 30 minutes before time. And of course, before administering the medication, we need to assess the client in sitting position, higher fowlers, or sideline position. So, sir, may I assist you? So, next is in orally administration. So, in this video, I am going to administer orally, buccally, and sublingually medication to the client. So, in orally administration drug, allow the client to hold solid medication in hand. Sir. And offer juice or water before and during indigestion. So, sir, inom muna po kayo ng tubig before mag-take ng medicine. And you can swallow the medicine po. Thank you, sir. So, after the oral administration, we'll move on to sublingually administration. In this administration, we will put the drug under the tongue of the client, under the client's tongue, until it will dissolve. Sir, sir, pakilagay na lang po sa ilalim po ng tongue natin. And hindi po natin isa-swallow sa ilalim po ng tongue. So, after that, caution clients against swallowing tablets or drugs, and we will assist them until the medication dissolves. So after sublingual, we will move on to buccally administration or buccal administration drug. In this administration, we will put the drug against the mucous membranes of the patients until it dissolves. Sir, pakilagay na lang po dito sa gilid po. Diyan. Thank you, sir. So, if medication falls in the floor, discard the pill and start over. And stay, just like what I've said earlier, stayed until client has completely swallowed or dissolved each medication, and place the client in comfortable position and replenish stocks used and clean works area, and after administering the medication, we need to wash our hands. We must record the administered medication on the MAR to provide documentation of the administration. Record and report intervention and client's response for communication to other healthcare workers, and allows for continuity of care for the client.